All right. Hello, everyone. We are live from our virtual town hall with Assemblymember Rebecca Bauer-Kahan for residents of San Ramon, Danville, Alamo, and Walnut Creek in regard to the COVID-19 response. Without further ado, I will turn it over to our host and moderator, Assemblymember Rebecca Bauer-Kahan.
Thank you, Matthew. And I'm happy to have Matthew with us. He serves this part of the district all year round, so he's an important part of this conversation. Thanks for being here, Matthew, and putting this together. Hi, everyone, and welcome. Thank you so much for joining us on this virtual town hall for the residents of San Ramon, Danville, Alamo, and Walnut Creek, and anyone else who chose to join us today. If you haven't already had a chance to send in your questions, we're going to try to get to as many of them as possible. We have a lot of people with a lot of information, so we may not get to all of them, but we'll do our best. So you can use the Q&A feature on Zoom if you're joining us on Zoom, or if you're listening on Facebook Live, you can email us at assemblymember.bauer-kahan@assembly.ca.gov, and we'll try to get as many of those questions answered as possible. Before we get started, I want to take a moment to thank all of you, our community. I know that the last few weeks of social distancing have not been easy, and it brought many interruptions to our everyday lives. But I'm proud and grateful for our community for staying committed, staying home, and flattening the curve. And you gave our healthcare workers a chance to battle this, and we are succeeding. We'll hear more from the county health officer, but what we are doing is working. Just today, I saw the numbers, and we are at, I think, a low of new cases, despite the fact that testing is going up. So I'm eager to hear more about that from the county officer. But that's because of all of you, because you're staying home and you're being safe and you're helping us flatten that curve. So thank you. I also want to express our gratitude to our frontline workers. We have many on the call with us today, but many of you are listening, or you live with a frontline worker, or you are supported by them every day. And it is because of you that our cities continue to function, that people are getting the needed healthcare services that they need, and that our community is safe and doing as well as it is. So thank you for doing your job and being there for all of us in this incredible time of need. We really appreciate it. I just want to say that both Senator Glazer, who's here with us today, and I are here to support you. We provide these town halls as a way to get information out to all of you, but this isn't the only time to contact us. You can call us. Our office line is being answered. Sometimes people are surprised when they get a live person, but we are there answering our calls. And I know the same is true of both the Congressman's office. I know we have some people on the line who are represented by Congressman Swalwell, others who are represented by Congressman DeSaulnier. Both are working hard to answer your calls. And also Senator Glazer's office is hard at work. So check out my website, call the number. We are there to serve you. And our website also provides important resources if you have questions. But without further ado, I want to move on to the very wonderful guests we have here to provide information. On the call tonight, we have my partner in the legislature, Senator Steve Glazer, who I want to invite to provide some opening remarks if he has anything he wants to say.
Thank you, Assemblywoman. Thank you for putting this call together and for all your good work in the district to help serve our residents during this difficult time. I certainly join with you in our thanks to all of our frontline folks in healthcare and the grocery chains, delivery people, all those folks who really are going above and beyond it to keep all of us food in our pantries and to help us in our hospitals and healthcare facilities. So I join with you in thanking them. As you have said, we're here to be helpful to our constituents. These calls are a great way to do that. I appreciate your efforts to do that. And I've tried to do the same. I have a website as does yours with all the telephone town halls that I've had. And I encourage people to check it out if they think it can be helpful to them. And thank you again.
Thank you, Senator. And I have to say, so I did a town hall on how to parent in a time of COVID, which I found really helpful. And the senator did one on distance learning, which I found it's changed the way we do distance learning in my house in a very positive way. So I recommend that one specifically, although he has a lot of good ones. It was the one that really touched me. So, and you'll hear me she gave me a little slack, which is what I appreciated. I don't know if you remember that, but I was relieved. She told me to take it a little easier on us as a family.
Yes.
So a lot of great resources on his website. And then with us also is Chanel Scales-Preston, the Congressman DeSaulnier's district director, to give a federal update. We have Dr. Radhakrishna from the Contra Costa Health Department. Joe Calabrigio, the Danville town manager, will provide a local update from Danville. We have the wonderful Chief Stevens from the San Ramon Police Department, who's keeping us safe day in and day out, who will talk a little bit about that. And Terry Kilgore from the Walnut Creek City Manager's Office. Welcome, Terry. And lastly, Lynn Mackey, the Superintendent of Schools from Contra Costa County, who will reassure us that our children will eventually go back to school, which is what I always want to know. And so thank you all for being here. And we will start with Dr. Radhakrishna. Most of our questions are actually for you. People have a lot of questions about the health and well-being of our community. So thank you, first of all, for being on the front lines and for keeping us so safe. I think one of the things that is really critical for our community to know, and many of you may have read about this in the news, is that the Bay Area really led the way. We were the first in the state and across the nation, really, to shelter in place in a very meaningful way. And we have seen the fruits of that. We have seen how safe it has kept us. And so I want to thank you and your office for making the hard choices, but ones that have really paid off in the long run. And we didn't know just how much they would, but it's incredible to see the capacity we have in our hospitals and how much we are able to take care of everyone who needs it. So thank you. Let's start with masking. This week, there was a change in the requirements related to wearing a mask out in public. So we got a lot of questions about that. Can you talk about why this change to require masking in public and a little bit about best practices as it relates to masking?
Absolutely. Let me start with the trend of where we're at, which leads into why we needed to do masking. Globally, 2.6 million people have been infected with this virus, which is as if every resident of Alameda and Contra Costa County combined have gotten this virus, leading to about 185,000 deaths internationally. In the US, 850,000 infections and 50,000 deaths. In California, 35,000 infections and 1,400 lives lost. This week marked one of the deadliest days in California, where 115 lives were lost midweek in a single day. Here in Contra Costa County, we have currently 770 positive cases with infection and 23 lives lost. About 36 people are currently hospitalized amongst our 9 county hospitals, and that number, fortunately, has been stable over the past few days. However, we now know that COVID-19, or coronavirus illness, is the #2 cause of death in the United States, after heart disease #1 and cancer being #3. So it's something that we take very seriously. We have flattened that curve and stretched it out. And people want to know, when will the peak and surge hit? In Contra Costa County, it may be in late May or early June, and we may face waves in the future, but we are doing an excellent job. We do feel fortunate we took bold early action across the region. We're in much better state than Italy and New York, and we're here to use science and data to guide us moving forward. One quote I like to share from Winston Churchill is that this is not the end, and it is not even the beginning of the end, but it is perhaps the end of the beginning. There is light at the end of the tunnel moving into the summer. Numbers are overall looking good thanks to the sacrifice and cooperation of the public, but we do have a long ways to go. The reason we implemented a universal cover your face masking order is science now tells us that a lot of people have this virus, are contagious with it, but never get symptoms or may have very mild symptoms, or they may not appear for a few days. That's different than influenza, where you get very sick early on and you don't even want to leave your house where you can infect others. So because of these asymptomatics and pre-symptomatics, we had to take additional measures to protect the public. You may have seen from Santa Clara that the first death in the United States was not in Washington. And the first California death was not March 6th. It was actually February 6th in Santa Clara. This tells us that the virus was circulating in the Bay Area much earlier than we anticipated. So we're glad we took early action. It also tells us that there is a lot of community transmission, possibly 5 to 10 times as much as we can prove with the testing that we've done so far, which is why we need the cover your face order. When we speak or cough or sneeze, an invisible cloud of those respiratory droplets can pass on to another person. If we're in public transportation, if we're in line at the grocery store, that's why we must cover our face to protect everyone. The message is that your mask actually protects me and my mask protects you. So only if everybody complies is everyone protected. You've heard the phrase, no shirt, no shoes, no service. Well, now you can add to that, no shirt, no shoes, no face cover, no service. People do not need to buy or wear an N95 medical grade mask. We need to save those for healthcare providers that are in close proximity for longer duration, doing higher risk procedures. People don't even need these paper surgical masks. Any simple cloth face cover will do, as long as it covers the nose and the mouth. You can use a scarf. You can get a simple cloth one with elastic on the end. You can sew one yourself. You can use a t-shirt or a bandana. I made one out of a kitchen cloth and 2 rubber bands. That's enough to prevent those droplets from getting passed, so there's no excuse. Anyone going out in public for any essential activities can use a cover your face method. And the really important message is it's not a substitute for our other prevention asks of the public. You still need to wash your hands, you still need to maintain that 6 feet of physical distance, and you still need to stay at home unless it's for an essential activity. The less movement and interaction, the less this virus will spread and kill more of our residents in Contra Costa County. So our message is, when in doubt, don't go out, stay in your place, maintain space, and cover your face.
Thank you so much, Doctor. And I know that, I thank you for highlighting, the lives lost this week. There were too many, and the 23 lives lost in Contra Costa County. But, I appreciate all the real thoughtfulness that is going into preventing as many deaths as possible. And today we saw face coverings. I know I saw a picture in the newspaper of Speaker Pelosi with a very chic scarf over her face. So lots of options out there. And I know people are coming together to make sure people have what they need to keep us safe. So the next question that we're getting a lot of, which I'm sure will not surprise you, is related to reopening, loosening up of our shelter-in-place order. Currently, it's set to expire on May 4th. I imagine that's not going to just be lifted overnight, but we got a couple of questions. One from Ray Shuvik, who runs a nonprofit organization, asking about whether you see in the near future a situation where we would allow gatherings where people are social distanced. So people able to be together in a place, but they're keeping their 6-foot distance. And then somebody else asking a question about Shannon Jean about when we'll be able to open more stores, right? Currently it's only essential businesses. When will the rest of the businesses begin opening? Can you tell us a little bit about that?
Yeah, every state and region is going to move at a different pace. We just talked about masking. 7 states have that. And here in the Bay Area, we moved together with 7 other health jurisdictions so we could be on the same page for our message. When it comes to the shelter-in-place order, likely next week you will hear an update from the region. Viruses cross borders, people cross county lines, and our public health prevention measures need to as well to protect the broader region where we do have a lot of urban density and early community transmission since January. So you may have heard the metaphor of the light switch. On May 4th, we're not going to be turning a switch on where everything goes back to normal. No physical distancing, no stay at home, no cloth face covers required. It's going to be more like a dimmer where gradually, with evidence and data, week by week, we're looking across the region and doing modeling and looking closely at our hospital numbers to see when we can safely start to reopen. So we do anticipate there will be some loosenings and modifications starting May 4th to be announced even earlier. And several times a week, we're speaking with our county health officials across the Bay Area so we can have a united message. We're looking at mathematical models, working with academic institutions to make the best decisions. And the more testing that we're able to do, the better we'll be able to have evidence guide these decisions. You should expect some opening up and loosenings. For example, lower risk activities, more outdoor activities are likely to start to open up. And it is going to be gradual. And that's so we can study it on a week by week basis to make sure that we don't hit that surge where we overwhelm our health system capacity. Right now, we can handle 3 or 4 dozen hospitalizations. But when it gets higher than that, we start to run out of isolation rooms, ventilators, workforce challenges. We've prepared for all of that. We've set up alternate care sites from the Craneway Pavilion to the county fairgrounds to shelters in Concord, should we need them. But our goal is to not need them at all. We're doing other things for congregate settings. For example, we've emptied all of our homeless shelters and put those individuals experiencing homelessness in hotels. Those who are vulnerable, we're guiding them there. And we're very particular to focus on the congregate settings where many of our elderly in Contra Costa are living. We have 2 outbreaks currently, and we're supporting all of those residential care elderly facilities to be able to decrease outbreaks. But testing, as I'm sure you'll ask about soon, is a key part of using science to start to increase that dimmer and start to open up our lives and economy. But as you've heard from the governor, life will be different for a while, be it with face covers or maintaining 6 feet of physical distancing, whether you're in a restaurant or a school moving into the future.
Thank you. And you touched on something really important, which has been something that we've been seeing is our numbers in the county are really reflecting an increased outbreak in these congregate care facilities. And we're seeing it as a huge problem, especially amongst those who are so vulnerable, because that's the populations that tend to be in these facilities. And we got a question from Nancy Dietz about the numbers that are being released in those congregate care facilities. I know the county has released the number of patients in those facilities that are testing positive, as well as the number of workers in those facilities. But she asked, are those numbers underreported because of HIPAA? Are there some sort of HIPAA guidelines that are leading to us not knowing fully how many people in our county and in our congregate care facilities have COVID? Can you address that?
Absolutely. So the numbers change on an hourly basis. Sometimes we run up to 4 batches of testing in a 24-hour period. We report them once a day, usually around noon, on our website, and that's publicly available at cchealth.org. We break it down based on geographic location, also based on age demographics. At the state level, they break it down based on race, which is helpful to see certain disproportionalities that we're noting, particularly in African Americans, as well as some Latinos and particular age groups. When it comes to the congregate facilities, again, those are being reported on a daily basis and changing, and those numbers are true numbers that we are reporting. So because of HIPAA or privacy, I would not say that we are underreporting what's happening in particular facilities. However, the entire nation and our county is grossly underreporting the true amount of community transmission. And that leads to the hot topic of testing, which I know several of your members have brought up as well. So if it's okay, could I answer some?
Yes, that's where I was going next. So go ahead.
Great. On the topic of underreporting, which also relates to, are we testing for the presence of the virus, which is with that nose or mouth swab, a PCR test to look for the RNA particles of the virus? Or are we talking about the antibody tests, which proves some people have been exposed and now have immunity? And I'll address both of those. Interestingly, the antibody tests, which aren't yet ready for prime time, very few machines have been approved by the Food and Drug Administration. They're still being validated. And in a couple weeks, we'll have more evidence on which machines we can use in different settings in the public to prove that you've been exposed and that you've had the virus. But some tests have been done. New York, most recently today, did a sample of 3,000 people, showing that 15% of the general public may have been exposed to and infected to this virus. Similar studies have been done in Santa Clara and Los Angeles, showing anywhere from 2 to 15% of people in the past few months may have already been exposed to this virus. And so we know there's a lot more out there. I'd say anywhere from 5 to 10 times as much as we're reporting. So if we have confirmed 770 cases in our county as of today, April 23rd, there may be 5 to 10 times as many people who have actually been exposed, and we'll be able to show that through some broader testing and community surveillance in the coming months. But what really people want to know about is if they need to get tested and to ensure that everybody can get tested who needs to be. And that is our #1 priority. We're proud to announce that this week we've set up 4 mobile testing sites in most regions of the county. And our goal is anybody with symptoms should get tested. It doesn't matter what type of insurance you have or where you live. So those are live, and the phone number's on our website, cchealth.org. Monday through Friday, you can roll by through any of these if you call first and get screened. And of course, you can go through your various health facilities. We've been working with all of our hospital and clinic partners. John Muir has 2 drive-in testing sites. Kaiser and Sutter has adequate capacity. And what we're actually seeing is we're not using all the testing capacity that we have. So far in our county, we're testing about 200 to 400 people per day, and estimates suggest it needs to be about 5 times that amount to really know what's going on in the community. So this is the week of aggressive testing that we're really pushing out, and we're really liberalizing who gets tested. We're now learning with the virus, it's not simply fever and a cough or shortness of breath. There are these less common symptoms like losing your sense of smell or taste, even having some mild upset stomach or diarrhea, and confusion and other symptoms in the elderly. So please call our number, 844-421-0804, if you'd like to be screened for testing. And if it's a low risk setting, you'll get those results in 3 to 5 days. And if you're a sensitive worker or living or working in a sensitive location, like a congregate environment, we'll get those results within 24 hours.
Thank you. That is really helpful. Kathy asks, what's the goal number? How many people a day do you want to test? And how close are we to achieving that?
Excellent question, and I actually have that number for you. First, I want to mention there are certain bottlenecks. Even the swabs for the nose and mouth, we're a little short on. Even the transport vials to move those to the lab, we're a little short on. But luckily, the machines and the chemicals in them, the reagents, we have plenty of. So as we get enough supplies, we will be pushing more aggressive testing. To answer your question, the Harvard Global Health Institute did some mathematical modeling and showed that if we really want to have a true understanding of where the virus is in our community and when and how we can increase that dimmer to reopen the economy and certain physical restrictions, we should be testing about 150 out of 100,000 people per capita every day. Right now in California, we're testing 29 out of 100,000 every day in our county, Contra Costa. It's a little less in California. So in Contra Costa, we're doing better than the state overall, but we're still about 5 times as short as we need to be. This is the reason that we're really pushing aggressive testing. And it's not testing alone, because when you get those positives back, you need an army of disease detectives to call those people, do the education about quarantine and isolation, and help trace all the people they've been in contact with to decrease the spread. That's called contact tracing or case investigation to decrease outbreaks in group environments. So we're scaling that up. We're using software and technology to multiply our capacity to be able to do that.
So do you think we're going to hit that 5 times? And if so, when?
Could you say that again?
What do you think? Do you think we're going to hit that goal that you just set of testing 5 times as many people as we're testing today? And if so, when?
I think we will. We're pushing for it. I don't know if that's months away or weeks away, but as we get the supplies to do so, as we partner more broadly, as we scale up our workforce, I think we can get there. And the answer is we have to get there. It's just a question of when. We've been behind as a nation and as a state in our testing. And as the Santa Clara case shows, they couldn't prove that that healthy woman who died on February 6th had it. They sent tissue samples from her autopsy to the CDC and we got the results a month later. Had we had more testing earlier, we would have been able to prove it to the public, but we're glad we took bold early measures and we're really thankful for our leaders and the public for complying. Our data suggests about 85% of the public are following our shelter-in-place orders and physical distancing measures based on traffic and cell phone data, and we're putting that into our models to decide when and how to lift things.
Thank you. And I know that, we're working on the state level to do everything we can to increase California's capacity. And the goal that the governor has set is 25,000 tests a day in California. And you mentioned swabs and the elements that we don't have enough of, which is part of what our bottleneck is. And I know there was exciting news this week that the state was able to acquire 3D printed swabs. And the problem there was they weren't able to be sanitized, which wasn't safe. And the state figured out a way to do that. And now those are being distributed. So doing everything we can to get you what you need to keep testing and make sure we keep our people safe. But I want to talk about testing criteria because that changed this week, right? And we were the first state to test people who weren't symptomatic, the first to say that there are some asymptomatic people will test. And Katha Hartley asks, will at-risk people in our area be able to get tests for undiagnosed COVID-19 cases? And she talks about living in a community, a 55 plus community with people who may have the antibodies, and when will be able to get that test and who will qualify for it?
So too early to tell. That caller is asking about the antibody testing to show that you've been exposed to it. And it's most helpful, as I mentioned in New York, to really get a sense of community surveillance, how many people have been infected over time for some of our modeling. For individuals, it's a little more useful if you're working in a high-risk environment. So say you're a nurse in an elderly care facility, you may want to know if you've been exposed. And it also leads to the question of how often do you test people that are at high risk? Believe it or not, we've looked at some protocols from Los Angeles from the pornography industry around testing for HIV at a certain frequency of every 2 weeks to prove that you either have immunity or don't have a virus at the time. And so for certain workforces and classifications, in the future, once we get the capacity and the FDA approves more of those antibody machines and tests, we will be able to test more workers and members of the public that are in high-risk environments, but it's not ready for prime time yet. As I mentioned with you all 2 weeks ago, there's a lot of invalid tests being peddled to various groups that are trying to make money off of antibody testing. So we do need to be cautious so we have the proper data to guide decisions.
That's right. I just saw a whole thread on a local mom's Facebook group about one of the non-FDA approved tests, and people are going to spend a lot of money for it. So, make sure you're talking to your healthcare professional and getting the right tests. And one last question for you, you have been so helpful, is we talked about how you that curve, we flattened it and we've stretched it. And Ron and Nancy wants to know, how can we say that our numbers are low, that we're flattening that curve if our testing capacity is so reduced from where it should be? Can you explain that?
Yeah, well, it depends which curve you're talking about. Are we talking about positive cases with the test, which we underestimate grossly and we're going to get better at as we test more? Are we talking about the curve of hospitalizations? That's our more sensitive marker because these are people who are sick enough to need to be in the hospital. And a lot of the reason we do this is to not overwhelm our capacity, our 911 system, our ambulances, our isolation rooms, and our ventilators. So we do have a good measure on who's sick enough to need to go to the hospital and test positive, because 100% of those people are getting test results within 24 hours. And that's where we're hovering around 3 dozen and it's stable and gives us a sense that we are flattening that curve rather than it going too high where we're overwhelming our healthcare system. That's a number that we're tracking. Deaths as well is a number that we're tracking. And that's a little inaccurate as well, as the Santa Clara case shows. There may have been people who died at home or were presumed to have died from influenza in January and February before we had enough testing that actually died from coronavirus. And as we factor that in, our numbers will likely increase. There's wide variations on these models, but the new push for testing is definitely helping. And our stable hospital numbers is very reassuring that likely in May, we can start to lift that dimmer and make some modifications to the stay-at-home order.
Thank you so much for all that information. I know that you've been on with us for other communities before, and you would just explain this in such a clear way and answer everybody's questions. And I'm so grateful to have you here in Contra Costa, keeping us safe and making smart decisions. And I know that we will continue to have to make hard decisions to keep our community safe, both personally and as a community and as a government. And I appreciate the wisdom that you provide to making those decisions. Thank you, Doctor.
My pleasure.
So now I'm going to turn it over to Chanel Scales-Preston, District Director for Congressman DeSaulnier, to give a quick update from the Congressman's office. She will let us know what's happening on the federal level, and I think we have some breaking news.
We do. Thank you. Thank you for providing me the opportunity to give an update on behalf of Congressman DeSaulnier in regards to the coronavirus pandemic. As you know, the Congress has passed 3 relief packages, and those packages were for our frontline workers, small businesses. A lot of that funding also went to food banks, as well as making sure that our students are getting 3 meals a day. And I know some school districts will be starting that next week for the students that are out of school. $850 million went to our food banks as well to make sure we're providing assistance for people who are getting laid off. Additional funding went to unemployment, which provided a $600 per week increase, and then also rebates for our married and individuals as well. About 45 minutes ago, the 4th relief bill just passed. I have it on my screen right now. I've been watching, and it's about $484 billion. That is going to our Paycheck Protection Program, which is part of SBA for small businesses. As many of you heard, the program funds ran out like within 2 weeks. And so they provided more funding for that program, as well as healthcare enhancement services as well. The funding this time around will provide more relief to businesses and also provide oversight to ensure that the small businesses are really getting the funding. I know you may have heard in the news that other businesses such as chains been getting the funding and not really trickling down to our small businesses. So that's really important that they get the funding to survive. Enhanced testing also is part of that package, and funding for our healthcare workers. And that package nearly doubles the last package from last time. It's also providing $75 billion straight to our hospitals to provide that support for PPEs and for testing. And Congress is going to continue to work on another act. It's going to be called CARES 2, and they're hoping to put health and safety workers, those people who are on the front line, such as our healthcare workers, police, fire, EMS, and other essential workers to get that relief money. They're also looking at local municipalities to receive funding. So a lot of the funding has been going out to the different states and the hospitals, but they want to ensure that local municipalities are receiving that funding as well. So it'd be interesting to see that new package come about within the next couple of weeks. That's my update so far. So if there's any questions, I'm happy to stay around to see if I'm able to answer. One last thing, just before I switch it back over to you, Assemblymember. We have been having so many calls in regards to the SBA PPP program. And so we're going to host a town hall with the small business majority tomorrow at 2 p.m. And former Congressman George Miller will be helping us host that town hall with the Small Business Administration. So if anyone's interested, please go to Congressman Mark DeSaulnier's website to sign up. And once again, that's at 2 p.m. tomorrow. And if you have any questions, our office telephone number is 925-933-2660. Thank you again.
Thank you so much, Chanel. And it's great news that there's more PPP money, because I know we heard from a lot of businesses too that needed that assistance and didn't get it. So that's great breaking news. And I appreciate your office being so responsive to all of our shared constituents. And I know that some of you on the line that are listening from San Ramon are served by Congressman Swalwell's office, and they're there to support you as well. So thank you, Chanel. And we'll let you know if we get some questions for you. Next up, we are going to turn it over to Chief Stevens from the city of San Ramon. Chief Stevens, thank you so much, both to you and all of your officers, for everything you're doing to keep us safe during these really trying times and putting yourself on the line to do it. We really appreciate you. And I just want to start by saying that.
Thank you.
So can you share an update from the city of San Ramon and what's going on there?
Things are going well. I think everybody knows that, in compliance with the public health order, we've greatly reduced our staffing levels. All of our public counters have been closed. However, I think we do want to ensure that our community knows that if you do call the police department or frankly any department throughout the city, even though maybe the public counters are closed, we still have staff there that will answer the call, answer your questions. So while our staff has been reduced, we still are focusing on essential services. We do have staff available. We're kind of in an interesting dynamic because, the efforts recently have been to, we've got staff working from home and identifying other tasks. And now we're thinking that with the way things are going, we're hopeful that there's going to be some changes and how's that going to affect us. So now we're trying to ramp up as cities that as things become more normal in our community and restrictions change as cities, how are we going to adapt to that? So it's an interesting transition. Our staff is just been fantastic. The ones that are working remotely, and just really proud of all of our staff members, during difficult times and And I know there are folks that aren't working, they're anxious to get back to work, and the folks that are working throughout all departments in the city, I think, are just really committed to the task. And just I know, speaking for the city manager and all the department heads throughout the city, I know we're just thrilled with the response, and we're ready for whatever changes are lying ahead for us.
Yes, well, thank you, Chief. And I know one of the things that you touch on is really watching the community come together during this time has been remarkable. I don't think any of us want to be in the position where we saw it, but it's been so great to see people volunteering and helping their neighbors and stepping up in ways that really make this work. And we're seeing that across the whole district, and in San Ramon as well, where you have a way to volunteer through the city as well, which is really neat. So thank you for that. So you are the Chief of Police. So you're out and about in the community, and you have a perspective on people in the community, how they're doing when it comes to abiding by the shelter-in-place order. Can you tell us how that's going, and give some reminders or recommendations if you have some to our listeners?
Sure. So, we since the order went in place, we've averaged probably 6 or 7 calls a day that we've gotten in through either our dispatch center or through our code enforcement unit of public health order violations. The most frequent, I would say, are landscaping complaints. We've had complaints about, let's say, sporting activities, things like that. Our approach really has been to gain compliance through education, and at this point, we've not actually had to take any enforcement action. The interactions that we've had with the community have been very positive. Once they're educated, as an example, we referenced the mask order that went into effect yesterday, and I had some pretty significant concerns that we were going to be overwhelmed with calls because people, not complying with the mask order. And yesterday, we only received 2 calls the entire day, and as of about 2:00 this afternoon, we had not received one single call. So that tells me that our community, they're doing their part. They understand the reasoning behind it, and understanding that it's not just for their own safety, but they're also looking out for the safety of others around them. And I think that they're understanding that, and I, like I said, I was really concerned that we were going to be overwhelmed with calls, and I've been very pleased that has not been the case. So, we understand that it's a difficult situation for a lot of people. Everyone's has been affected in one way or another. And we understand that people are going through difficult times, and so we're really just taking the focus that we want to educate people. Our model is always that we're a partner with our community, and so far so good. I think our community, as you mentioned, is really coming together and understanding that we all want to get back to a normal way of life at some point, but to get there, we need to jump over some hurdles, and I think that certainly in the San Ramon Valley, that's what we're seeing on a daily basis.
Yeah, well, thank you for that. And I think that's right. And that's what I'm seeing and hearing, and it's phenomenal. So I appreciate that insight. And can you let people know if they have a non-emergency need, what's the best way to get in touch with you?
Well, of course, they can call our non-emergency number, but I'll do a shameless plug that a couple weeks ago, we actually started offering what we're referring to as virtual SRPD. And what that means is that a community member can go to virtual SRPD at sanramon.ca.gov, just shoot us an email. And one of 2 things will happen. If there's just a question that we can answer via email, we will do that. However, if someone would like to have an interaction very much like we're having here this afternoon, we will reach out and contact them over Zoom and actually do a teleconference with them as well. So if you go to our website, you will see that link. And it's something that I think even beyond this, we're probably going to continue to offer that service. So again, just finding another way. It's an example of you get in some difficult situations and you start doing some things differently, and then you realize, okay, well, maybe this is something that we even want to do beyond this. So that is a new service that we've started offering as of a couple weeks ago, and I think we will likely continue that for the foreseeable future.
That's great. Thank you for being so accessible to all the residents in San Ramon Valley. And I want to thank you for being here, Chief, and everything you do for all of our residents. And I also want to encourage everyone to check out San Ramon's website, which is really phenomenal and has a lot of resources. And also the mayor has a virtual breakfast, which is on Friday mornings. I was there last week, and I think the senator was there 2 weeks ago, and the supervisor, Supervisor Anderson is there to provide updates, as are others. So it's a great thing to check out, and I know it's available on the website if you want more information about that. And now we're going to talk about the town of Danville. So we have Joe Calabrigio, the town manager of Danville. Joe, thank you so much for joining us and everything you do to keep the town of Danville running smoothly in these trying times. Can you give us an update on what's happening in Danville?
Sure. Well, I'm happy to, but first I want to thank you, Assembly member, because given us this opportunity today. And I also want to say that based on all of my years of service, all of the faces on the screen are pretty familiar. I've never seen the level of communication and cooperation back and forth among agencies at a state, local, and countywide level. So I appreciate that very much. You know, what I would say is that we had a little bit of a heads up that the health order was coming, and so you know, we have done everything that we can to position ourselves to be able to deliver services as seamlessly as we can throughout this process. And some of the things that we were able to do was make sure that our staff had the resources that they were going to need to be able to work from home. So that when the 16th rolled around, we pretty much hit the ground running. And so we've been able to continuously provide all of the essential services that we're providing here in the community. And our staff is here to help. All of our operations are ongoing, either on site or via telephone and email. So community members can reach us the same way that they always have. And if I have someone who's working remotely or from home, their phone is going to be forwarded to a cell phone, and they'll be able to respond and help whoever it is that needs help. We adopted a declaration of local emergency back on March the 17th, and so since then our focus has really been on 4 areas. Those being to keep our community safe and do what we need to do to administer the health orders. Second is to continue to provide those essential town services. Third, we want to do everything we can to keep our community members informed. And then we're doing what all local governments are doing at the same time, and that is that we're adapting our operations and our finances to sort of conform with the fiscal impact that is being presented to us. So. You know, safety-wise, our police department is continuing to make sure that they ensure continuity of critical law enforcement services while they're enforcing the health order. We have set that up so that people can use our customer relations management, our CRM app, if they want to report a violation or if they want to track those. We've set up an incident management team that we have that is working with me to provide information and work through this. Some of the things that we're doing more specifically as we gear up to reopen, we're going through and looking at all of our buildings, all of our facilities where we interact with the public, and we're installing plexiglass barriers and other things that we need to do to keep people on both sides of the counter safe. We're doing the same thing with all of our employees, and in particular the employees that work out in the field or who interact with the public on a regular basis, with our public works crews, because what they're doing is essential. We have actually divided them up into 5 different teams that are staging out of different locations, because we already had an experience where we had them in larger teams and ended up with half of them being quarantined when one of them became ill. So we learned that lesson, and we want to do everything we can to keep them safe. We're doing things like partnering with our local businesses and volunteers to provide materials for making masks. And we've also procured some disposable masks that we're in the process of distributing to the community. and to the doctor's comments previously, we're starting with our most vulnerable and highest risk populations when we do that. We're a community that likes our special events, so we are working with event organizers to cancel and or postpone those at least into the fall. I think one of the other questions that I get asked quite a bit has to do with the cessation of construction activities and how are we dealing with things permit-wise. We are, permit-wise, we're expanding the range of services that we have available online, including building, planning, and engineering permits. We're continuing to issue permits for those types of activities that are considered to be essential. And more importantly, we're taking in new applications and processing those so that when the shelter order is lifted, we're going to be ready to issue those permits as promptly as we can and get people in those industries and trades back to work just as soon as we possibly can. Let's see, what else do I want to mention? Our parks continue to be open, although the features within our parks, the active features, the sports courts, the play areas, the picnic areas, restrooms, and the like, water fountains, those have all been locked down or cordoned off in accordance with the health order. Our recreation staff is busy looking at the kinds of activities that they're going to be able to program coming up this summer, which is usually the busiest time of year for us once summer vacation lets out. I know that we've got some great children's programs and activities that you can find on our website and through our library for people that have young children. I think you know some of those people.
Just a few.
You might actually be one. We're also spending a lot of time working with our business community, our local area chamber, trying to work hand in hand with them to help our businesses get connected with some of the financial aid that was talked about through the CARES Act and what is yet to come. We distributed a business recovery survey to about 1,900 of our businesses to help assess their health and identify what their needs are. We've developed a business resource guide. We've deferred payment on our transient occupancy tax for at least a quarter, and we're continuing to use our website to encourage our community members to support our local businesses wherever they can, whether that's through buying food to go or purchasing placing online orders for the goods or services that they sell, maybe purchasing a gift card, or even contributing to the GoFundMe page that our chamber has set up. Lastly, I guess I want to say that our public information team is continuing to do, I think, a great job of updating our website at least daily. A lot of information on our website, the stuff that we think is probably the most locally relevant to our residents here, news, updates, some of the frequently asked questions. We've got links to other websites on there. So we want to continue to urge people to go there and check us out at www.danville.ca.gov. Along with our various social media platforms to get the latest information that we have about the status of the shelter order and what's going on here in our local community. And I just want to also give a shout out to all of our emergency responders, healthcare professionals for everything that they've done, and the other essential service providers who are working hard and I might add with some exposure to themselves as they keep us supplied with food and essentials. And want to thank our residents as well who have adapted to the current circumstances and are really, I think, doing a terrific job of complying with the current health order, and just ask all of them to take care and continue to stay safe.
Thank you, Joe. That was really helpful. And I have to say that one of the mother of young children, your local bookstore has an amazing story time that my family is attending. So lots of resources out there, both from our cities and our businesses, to keep our kids occupied for those of us that are always looking. And I have a question for you from Cheryl Clutter, who wants to know about the Danville Farmers Market. She understands the need to social distance, but she was really looking for an update because she misses her fresh fruits and veggies.
Well, that's something that we're working on right now with the Pacific Coast Farmers Market Association. We've come up with a plan that would alter the layout of the market in order to be able to increase the social distancing for those who are attending the market, keeping the patrons safer as well as the vendors themselves. I think that we're waiting to see what's going to happen with the next information that comes out of our health department to determine when the market is going to be back to reopening. We contemplated doing that a couple of weeks ago, and actually we got a lot of pushback from community members who were really concerned about the timing of reopening the market, the message that sent, and concerns about how that might coincide with any surge in the number of cases. And so, even though it's something that is permitted under the current health order, I think that our Farmers Market Association, given the fact that they've been a member of our community for almost 30 years, they thought about that a little bit and walked it back and said, you know, we want to make sure that the community members are going to be comfortable coming out to the market, and we'll continue to work with you and figure out when the best time will be to do that.
I appreciate that thoughtful approach. And in the meantime, Cheryl, San Ramon has a farmer's market that's open where you can order online and it's ready for pickup, and that's on their website. So that is something next door, and I'm sure you'll be back at Danville when it opens. And I know the senator has something to add.
I just wanted to say we're working on home delivery as well.
Oh, great. So maybe that's coming to Danville soon as well.
Yep.
Assemblywoman, I was just going to say, I did a town hall today that incorporated the farmers markets, the leader of the farmers market in our area that does the work in Danville. And we had a lot of good questions about whether proper procedures are being done. And he went through a lot of the new requirements that he believes they'll be fully in compliance with in Danville and in the other markets. And there's certainly a lot in the areas that are open. It's really important that we support our farmer community. We have a lot of farms in Oakley and Brentwood and all throughout California that are suffering with this whole virus supply line challenge. And the farmers market is a really great place for us to support the farmers and bring that fresh produce in that we so much enjoy. So I hope that it can all get worked out soon.
Yeah, I know it's a part of my community that I love. Dr. Rohan.
If I could just add, if there's any questions about what can and can't happen in regulations, please call our call center. Environmental Health inspects all restaurants as well as farmers markets and has checklists about how to conduct them safely. We strongly believe that housing is medicine, food is medicine, and want to promote that. And we have plans to how to do that safely. So even with modifications that are likely to come in the coming weeks around the health order, please check our website, cchealth.org, and our call center during daytime hours and 211 after hours to answer any questions on what needs to be modified or is allowed.
Thank you. That is super helpful. And it's true. Yesterday was Earth Day and my family planted a garden because it is these locally sourced vegetables that keep us healthy and happy. So thank you for working on that. Thank you, Joe, for the update from Danville. It's really helpful. And we're going to turn it over now to Terry Kilgore, the Assistant City Manager of Walnut Creek. Terry, welcome. Thank you for everything you're doing in Walnut Creek to keep our residents safe. And will you give us an update on what's going on?
I will. Thank you so much for having me, Assemblywoman. I will say specifically to Cheryl, downtown Walnut Creek Farmers Market is actually open on Sundays at 9 a.m. And we have instituted much greater spacing between vendors to comply with the ordinances and orders. So come on down, we'd love to see you. And I know Alamo Plaza actually has a Sunday farmers market as well. Haven't seen that myself. We are doing many of the things that Chief Stevens and City Manager Calabringo mentioned as well. We've moved to an almost entirely digital approach to doing our community services. Arts and Rec is online. And even our council meetings and planning commission meetings have moved online with the interest of keeping as much pre-work as we possibly can going so that when the economy does reopen, we're ready to match that demand for affordable housing and many other projects. Much of our work has been around coordinating with our partners at Rossmore, the Chamber, the CVB, and our Downtown Association. One, to make sure that we're getting resources to seniors and those in need of assistance, as well as to supporting our business community. We are proud to announce today that we have launched a new volunteer and neighbor matching service called neighborhoodexpress.org. You can click on the Walnut Creek icon, whether you're a senior needing someone to go do your grocery shopping for you or deliver some things that you might need from the grocery. You can sign up for needing assistance. And then we're also taking volunteers in from community members who are looking for a way to contribute to their neighbors.
That's great.
It's open now. Feel free to sign up, and we'll be doing that matchmaking between folks. And then we do have a senior hotline available, and actually it's open to anyone in the community if you just don't know who else to call, at 943-5852. Feel free to give us a ring, and our staff will do our best to direct you to the right resources. And then the other thing we're doing is spending a lot of time thinking about what will recovery look like. Right now, we've got 168 businesses in our city still open as essential businesses. You can find that on the city's webpage, /open, where there's a map-based search feature if you're looking for a dry cleaner or a restaurant that does takeout or delivery to frequent based on your area. And so that is open and going, and then we're doing some additional marketing around it to make sure our businesses know that we hope, just like our community members, they're being safe, but that everyone knows to shop local and to help keep our neighbors in business as best we can through this challenge.
Thank you so much, Sherry. I was just, we got our ramen fix the other night in Walnut Creek, and I was so grateful that was open. One of the things I cannot cook. So appreciate you working with our local businesses to keep them open and keep us fed and well taken care of. And I love that new matching program. So I hope people in Walnut Creek will reach out and participate, because really taking care of our neighbors is how we're going to get through this. We are doing as much as we can, but we need all of your help. So thank you for that incredible work. And now we're going to turn over to Lynn Mackey, the Contra Costa Superintendent of Schools. Lynn, thank you so much for joining us. And happy to have you here to provide information for students and parents. Can you talk a little bit about, we're not going back to school this year, and I think many of us are wondering what's in store for us in the future. There's been a lot of rumors about it, but can you just give us some insight into what
Yes, and thank you, Assemblywoman Bauer-Kahan and Senator Glazer. I really appreciate these forums and the town halls that you have been hosting. I think they're very valuable. And thank you for the opportunity to share what is going on in the schools in our area. I do want to begin by recognizing the extraordinary work that our Contra Costa school districts have done in their communities. I think the superintendents and their staff and teachers have done a heroic job in transitioning from our century-old classroom model to a distance learning model under great pressure and speed. And I just want to commend every one of them. And as we all know, so we moved to a distance learning model in mid-March. And we will be continuing with that distance learning model at least through the rest of the school year, if not longer. And that decision was not an easy decision to make.
Don't say if not longer, Lynn.
I just want to say we are working closely with our health officers to make sure that we are making the right decisions to keep our students and community, our whole community, safe. So we do meet regularly with Dr. Rohan and his team, and we take our guidance from them, because this really is a health crisis that we need to follow their direction. So yeah, I know it's been challenging for parents and caregivers. I recognize that many of the decisions we're making don't feel perfect, as everything is moving so fast. And I also want to recognize that some folks in the community don't like the decisions we've made about closing schools or the distance learning. And I know at times that it seems like there may even be an overabundance of resources that can be overwhelming to parents and families. And what I recommend is that parents and caregivers focus on the resources that are being provided from their individual teacher and their school and their district. I know that Superintendent Morgan in Walnut Creek and her team have all their information posted on their website. You can go on their website and see the FAQ and click on links that go to their parent presentation, to their classroom presentations. and have all their resources for distance learning. And Superintendent Schmidt in San Ramon and his team have done an amazing job in this area with their plan and communications, and all those resources are on the website. Whatever your district your child attends, I really encourage you to stay connected with school. Stay connected with your teacher, stay connected with your district. It really is important for students' well-being and for the how they will come back to school is if you stay connected right now. I know there was a question about school meals, and so I want to let you know that school meals are being provided. In the Walla Marinda area, you can grab and go at Campo Lindo High School and Las Lomas High School, and in San Ramon, you can grab and go at John Baldwin Elementary, Walt Disney Elementary, and Gale Ranch Middle School. Schools are also working to provide mental health counseling and other health type of resources like the social emotional resources. So please reach out to your schools if you're in need. And also a great resource is our 211 in our county. They have resources for all your needs. And you know, I do feel like schools are the backbone of our society, though I must say very woefully underfunded backbone. But I think it is really important for us to try to create normalcy as much as we can with our children through their school program, however that looks for your family, because I know it looks different for every family. And I know there's been a lot of questions about graduation and promotions, and I assure you that each district is working with their PTA, with their families and their communities, and they will be finding an exciting, meaningful way to celebrate and honor student achievement. And I really do want to thank the educators in our community. I feel like they are just right now on the front line working with students and families and trying to make sure education is being carried out in our county. I also, on another note, want to, anybody who is an essential worker, medical staff, first responder who's looking for childcare, right now they can go to cocokids.org. And there is some emergency childcare being set up and worked with this through the county and through some organizations in the county. So that conversation, I've had questions about that. So I do want to refer everybody to Coco Kids. And thank you. I really do. Thank you again for having this forum. I really appreciate your work.
Thank you so much, Superintendent Mackey. And I joke about needing to send my kids back to school because, you know, I feel that a lot. But we probably appreciate our teachers more than we ever did. And, you know, the work they've done, as you said, it's heroic and it is phenomenal. And my kindergartner got with me this morning to pick up his books, and we didn't get to open the window or anything, but he got to wave to his teacher, and just seeing those moments in these times really are heartwarming. And I know that his everyday Zoom call with her is really keeping him in a happy place. And so I'm so grateful to our schools and for putting safety first, which is what you did. And I think that that's critical for all of us. And I want to thank the schools for that. So even though I know, having 3 elementary age children, how hard this is, you're making the right decision and we're keeping everybody safe, and they will be back as soon as it is safe. And it may look different. And I think that that's something we need to realize and look to. But I know you and our schools want to educate them as much as we want them educated, so that will happen as soon as possible. But I do have a question that we got from Leslie Graham. She said, looking forward to schools being open, she's a parent like me who's anticipating that, she wants to know about how she can help protect the school staff, especially those that are 16 over in high-risk categories once we get back to the classroom. So, and I can ask Dr. Rohan to chime in as well, but just what can we do to be partners in that, and will you let us know?
Yes, and we will be working with our health officers to provide guidance around whether or not, even when we first start rolling out, and what that might look like, whether we even want the most vulnerable folks in the classrooms. You know, we really will be looking to the health officers to guide us in that decision. So I don't know if Dr. Rohan, you want to comment on that at all?
Yeah, there's a spectrum of risk, and we're learning with the science. It can be based on age, on existing medical conditions, on the type of environment you may live in, or who you may come into contact with. And we're already using that guidance to figure out who should be staffing these emergency childcare centers. I want to thank Superintendent Mackey. We've been working closely throughout the past few weeks to help stand up these emergency childcare centers. And we've been using some of that thinking around who may be the best workforce as we start to move up that dimmer switch and open things up. So we'll continue to put safety as the key priority, but know that education is health too. And we do want you to know that all the health officers in their decision-making in the coming days before modifications to the stay-at-home order take place are carefully weighing the health harms that are occurring from the stay-at-home order. We know that long-term shelter in place can lead to increases in child abuse and intimate partner violence and changes in educational equity and poverty, which independently takes 8 years off one's life expectancy. So we weigh all those very carefully when using the science we have at hand to think about the safety of the public. But we'll continue to partner with every sector and workforce, so as that dimmer switch comes on, we can get the right people back to work in the right places at the right time.
I really appreciate that. And I want to add one thing about lunches. So in the past, before this COVID-19 crisis, you had to qualify for those free and reduced lunches in order to get them at school. And I want to point out that that's not true anymore. If you show up at one of those sites that Superintendent Mackey mentioned, they will feed you, they will feed all your children, no questions asked. And the children do not need to come with you so that you can practice social distancing. So we really want to make sure children are fed and healthy. And so please, if you need your children fed, do not hesitate to show up at one of our school sites. And I know Superintendent Mackey will echo that comment as well. So I want to give a little bit of an update about this state, what's happening at the state level. You heard from all these amazing people at the city, county, and federal level, and I want you to know what we are doing to work hard for you. We are there, as I mentioned, to answer questions about the federal programs as well, but you can reach out to the congressional offices. We are all here to help you get that assistance. One of the things that has come up, and we actually got a question on this call about it from Ron, who wanted to know about mortgages and landlords. He's heard about some of the eviction relief that is going to tenants, but he's concerned about relief for landlords. So I want to mention the mortgage relief that the governor announced, which hopefully is a little piece of relief for landlords. So eligible homeowners can defer their mortgage payments for at least 3 months through most banks. One of the things I really want you to know about that is that you must call your bank. That is not automatic. You must work with your lender to ensure that you get that relief. But if you have a COVID-19 reason, and that can be that your tenant isn't able to pay, then please reach out to your bank to get that mortgage relief to match that eviction relief that we have moved forward. And we are really cognizant that we cannot give relief just to tenants without giving it to landlords, that the whole system needs relief and that you are a part of that. But that applies to all mortgage holders. So if you're worried about your mortgage on your own home, please reach out to your lender, because there is relief there and most banks are participating in that program. Although we as a state don't have the authority to make that law, that's a federal concern. But you know, we are here negotiating with the banks on your behalf. We also worked with the utility companies and the electric companies to ensure that no one's utilities are getting turned off during this crisis. So please don't make that a top worry. We want to keep you safe. We know that finances are tough, and your water and your electricity will not be shut off. So that's important relief that I want you to know about. Tax deadline, something people are really concerned about. So I want to reiterate that both the state and the federal tax deadline was moved to July 15th. So you don't need to worry about paying those until July 15th. Property taxes were due on April 15th. If you were unable to pay those, the assessor is able to waive any fines and penalties. But again, please reach out to the assessor's office. My office can help connect you with those programs. But if you have a hardship, we can ensure that you do not get penalized for your failure to pay. The assessor will make sure you don't get penalized. That program is available to you. One question we get a lot is the DMV. Some of you have licenses that need renewing that require you to go to the DMV in person. And reasonably, and since you're listening to our wonderful county health experts, you're concerned about going and waiting in line at the DMV. So I want you to know that there will be no ticketing for expired license for at least 120 days. So we don't want you to go wait in line at the DMV. You do not need to worry about that license right now. Once things are safe and you're able to go do that in a safe manner, you'll need to go do that. But for right now, for high-risk pools, you know, you have that 120-day exemption, and that will extend if the shelter-in-place order is extended. Lastly, I want to talk a little bit about unemployment insurance, and that's something people are really needing right now. We went from a record low unemployment to need we never could have anticipated. And we are here to support you in that. We want to make sure you have the money to buy your food, to take care of yourself, and unemployment insurance is an important way to get that. There has been some hiccups in that, as you can imagine, from an agency going from a record low unemployment to this need. It wasn't easy, but they have ramped up the number of people in the EDD department to make sure that we were able to process those applications. Just so you know, they were receiving about 100,000 applications a day, and people are working around the clock in order to support those that need it. Currently, EDD has extended phone hours from 8 a.m. to 8 p.m., and you can call anytime during those hours and you can get your questions answered. They are trying to get through those checks as quickly as possible. Prior to this crisis, there was a 21-day turnaround on those unemployment checks, and that continues to be the timeline. So I have to give credit to EDD. Despite all the hiccups, they were able to maintain that 3-week timeline despite the huge surge in need that they saw. So again, you should see that check within 3 weeks, and please reach out to my office or the senator's office if you don't see that check and you need it. One thing I want to point out, because it's coming up, is that the federal government passed a program called the Pandemic Unemployment Assistance Program. It's a brand new program that provides these unemployment insurance benefits to independent contractors and those that are self-employed. And that program will come into effect. It's in effect, but the form you need to fill out will go online on April 28th. Now, if you already have a debit card from EDD, you will get those funds within 24 to 48 hours. We've now found out the timeline will be a little bit longer if you don't have that debit card, but they will try to get you those funds as soon as possible. But if you are an independent contractor or self-employed and you need that assistance, and I want to remind you that right now, unemployment insurance, it's not just for the unemployed, it's for the underemployed. So if you've seen a cut in your paycheck, you're eligible as well. So, and the advice we're getting from EDD is if you don't know if you're eligible, apply. And they'll let you know one way or the other. But if you need assistance, please reach out and we can help you try to figure out how to navigate that. So that's a little bit about what's going on in EDD. But again, reach out to us, check out our website. There's a lot of information out there, and we're here to support you in getting those much, much needed checks for those who need them. A couple of questions that came in for me. So one was about relief. So many of our small businesses are closed and still need to pay rent on their leases. Is there any relief expected from local and federal agencies? I shouldn't say for me and for Chanel from the federal government. So you heard Chanel mention PPP and the re-upping of that program, which is the small business loans. And those loans are actually really well, I want to give credit to the federal government, well designed, and they provide relief for you to pay your overhead and to pay your employees. And when you're paying those things, some of that is forgiven, in fact. So it's more like a grant than a loan if you use it in certain ways. So as Chanel mentioned, they are having a town hall tomorrow. Chanel, tell us what time again.
Tomorrow at 2 p.m. with the Small Business Administration.
Perfect. And then we have on my website, we did a program with the Small Business Development Corporation as well. There's a little clip we have answering some questions there. But one of the things that I learned in that is that there's 2 different programs to apply for. And, you know, it's complicated how to use that money to get the most out of it. And so reach out to these resources so that you know how to apply, what to apply for, and how to maximize those benefits. But we are looking out for our small businesses. We know that this time has been incredibly hard on all of you, and you are the engine of our economy. And when this all comes back up, we want you to still be there. So both the state and the federal government are looking out for you. The state has put an additional $500 million into a program to fill the gaps left by the federal government. That won't be enough, but it's a start. And we're here to continue to look out for you as we look towards recovery to make sure you are a part of California's recovery. And then I got a question from Shannon Jean about in-person voting. This is a question we get a lot because people are concerned, especially we saw what happened in Wisconsin just a few weeks ago with people waiting in line for hours when maybe that wasn't the safest thing for them to be doing in the middle of a global pandemic. And you know, people are concerned this will still be around and what will happen to our election in November. And luckily we have engaged voters who want to vote. So I want you to know that the state is really looking at this, and then a bill will start moving, authored by the chair of our elections committee, and then I'm co-authoring that will move to the state to entirely mail-in voting for November. We want to be ahead of the curve and make sure that we're prepared to collect all of your ballots and give everyone the right to vote. And so that is in process and will be moving to ensure every county every county enables their voters to vote by mail and not have to show up in person. So we are on top of that. We are looking forward to our election and making sure that you will be able to exercise your right to vote, because it's a fundamental right that we want to protect and you deserve. So I think that was not all the questions, in fact, because we got so many, but we're 15 minutes over. So I do want to say thank you to everyone who has joined us. All of you are incredible and working incredibly hard to keep our community running. And I really think that we have seen some amazing things come out of this and our community come together. As Joe said, at every level of government, we are working in concert to make sure that we are trying to serve our communities and keep us functioning during these trying times. And we're starting to look forward as well to recovery and making sure that we are working as a unit to reopening the community when it's safe, making sure that our small businesses are still around and that you are able to get back to life as you once knew it and enjoyed it. So thank you all for joining us. Again, websites are out there to help you. You can follow us on social media for information. But I want to thank all of our participants and thank you for everything you're doing to keep our community safe and keep us together. So stay safe, stay healthy, and thank you for coming.
Thank you.